Hi, I'm Tim Wiedrich, Section Chief for the Health Resources and Response Section with the North Dakota Department of Health, and this is our statewide long-term care tactical meeting for COVID. A couple of things to get us started. Number one, please take a look at your microphone and make absolutely certain that your microphone is muted. I know that at the beginning of this program we have 45 microphones that are unmuted, and once we've muted you, then you won't be able to participate in the conversation any longer. So please take a look at your microphone, make absolutely sure that you are muted. Otherwise, when sound breaks through and disrupts the program, Clint has to go in and find you and mute you, and then you're not able to be unmuted for the program. So please do that now. We're going to be coming back to the questions at the end of the program, and we're going to be taking those orally, so please be prepared for that. And this is a jointly sponsored meeting, and we're going to be going to Shelley Peterson in just one moment. But Shelley, as I throw it to you, in addition to whatever opening comments that you may have, I know that we had some conversation a while back, or at least it was my intention, to talk about reducing the frequency of these meetings during the summertime from this point forward to once a month. And if you have a thought about that to share, now I'm putting you a little bit on the spot, but if you care not to respond at this point, we can have this conversation a little bit later as well. But let me turn it over to Shelley and see what opening comments you may have.
Tim, and you must have been reading my mind, because my first opening comment was, look at the agenda. It's nice and short. So absolutely, I agree with you. Since summer is a period of time which we all enjoy and want to have a little bit more time with our families, I think everyone would love to go to monthly. So that sounds like a really good plan, Tim. The agenda is short, as I said, and that just indicates things are no. I know that we're having a lot of people that aren't yet muted, so if you can mute, that would be wonderful. The second comment that I wanted to make, and I think it's been since last summer that we've been able to really see these numbers, is that the numbers are fantastic. In looking statewide on the website yesterday and this morning, so I don't know if they updated it, there are only 4 residents statewide that have COVID and 18 staff. So a total of 22 individuals working or living in a long-term care facility. That is really, really good. Those numbers haven't been that low in such a long time and are such a stark difference from mid-November when we were at 1,630 in one day. So congratulations. The vaccine is absolutely making an impact. You are making an impact, and the numbers are great. So yes, Tim, we look forward to monthly calls this summer. I'll send it back to you.
All right. Thank you, Shelley. Well, let's go ahead and launch on into the agenda, even though it is brief. Jenny Galbraith has immunization information. And of course, this is a very important component of our long-term care response. Jenny?
Let me get my screen, well, or maybe not here. I will just go ahead and go through it myself then, since it won't let me share my screen. So our long-term care rates for residents continue to remain steady in the low 90s. For one dose for vaccinated residents, that's 92.93%. And for a complete series, we're sitting at 91.69%. So really good to see that our residents are continuing to be fully vaccinated. And as new residents come in, that we're continuing to vaccinate them and not kind of let them drop off. So that's great to see. Unfortunately, for staff rates, we are still kind of sitting in that 62 or so percent for one dose. And we really haven't seen a whole ton of movement. I believe this week we saw about a 0.6% increase at 0.6. Of course, every little bit helps, but we would love to see a greater increase, especially now that CMS is going to be requiring some additional work on the vaccination front. We do have a considerable number of all-stars. I'll let everyone kind of read that list that Vanessa sent out. But again, as always, a plug, if you're an all-star that's on this list and you have something that's new and innovative that you've done to increase your vaccination rates, please give us a call, shoot us an email, and we kind of want to know what you've done and how you've gotten here. And of course, another plug, the FQIO, Quinn is doing their long-term care ambassador. So if you've not answered them about sharing your rates and sharing your best practices, now is a great reminder to do that. I do know that a part of the CMS or new requirements are education of staff and residents. So I did want to remind everyone that on our North Dakota Department of Health immunization page, we do have a considerable number of education opportunities for COVID vaccine. And another thing that we do have is our declination form. So as you have staff and residents or families that do decline that vaccine, it is a nice form to go through and kind of highlights the risk of not being vaccinated within a long-term care. And then, of course, our NDSU team is still willing and able to come in and do webinars or virtual meetings or just record videos for you all as education for your staff and residents. I did want to bring up really quickly, you may have seen in the media or through Molly's emails, if you're signed up for our emails, about the myocarditis events that have been reported throughout Europe. And if just as a reminder, if everyone can mute. So there have been some events of myocarditis seen after Pfizer and Moderna vaccines, so those mRNA vaccines, and that's been reported mostly in Europe at this point. The CDC and VAERS continues and FDA continue to look at this in the United States, but at this point, there's not been a safety signal that's been triggered in our reporting system in the United States. So we are continuing to recommend COVID-19 vaccine for people 12 years and older with those Pfizer vaccine that's now available. And then I did want to lastly put in a quick plug. If you are a COVID-19 enrolled provider as a long-term care, there is a potential you will be reached out to shortly in the near future for a COVID-19 site visit. So this will be with one of our COVID vaccine coordinators, and it's nothing to be stressed about. We just basically need to make sure that you know what you're talking about, we know what we're talking about, and everyone's kind of on the same page. We are prioritizing high volume providers first, so it's likely that long-term cares will be considerably lower down that list just with your nature of how you're giving vaccine. But nothing to be stressed about. We just want to let you know that there is a potential you may be contacted. And that is all I have.
Thank you, Jenny. Let's move on now to Shelley, and there's some additional information that Shelley has about the nursing vaccination data and reporting and CMPs, civil money penalties. Go ahead, Shelley.
And it's not additional information, but it's continued information. And probably what we'll do as an association, given we won't have tactical calls probably in June, or at least one, we will continue to remind you of this requirement. As you know, CMS came out with a new regulation. That regulation was, if you can mute, that would be great. That regulation put a new requirement on nursing facilities, and it's nursing facilities at this point in time only, not assisted living, not basic care, but nursing facilities effective May 21st. The rule was effective May 21st, but will be enforced on June 14th. So it actually is in effect now, but CMS will not enforce it. And that new rule is the reporting to HNSN, all your vaccination data. And so what that means is you're strongly urged and encouraged to report that data now. If you wait until the June 14th date, and June 14th is on a Monday, so by midnight on that Sunday night, which is June 13th, if you do not report or you have not reported, you will get an automatic CMP. It's a paper deficiency. They automatically send it to you, and you're going to have to pay a fee. And it's a progressive one. So if you continue to be out of compliance, your next fee is going to be a higher fee or a CMP. So we found that last time, I think it was the PBJ reporting requirements. If facilities waited, they seem to have some transmission issues. Please do not wait. Don't wait until that Friday before the requirement, or you may run into trouble. And it's an easy process. There's easy process in the sense that there's been a lot of education on this. There's been a lot of information. And so I urge you now, since we're going to be embarking on June 1st next week, that you begin reporting. The requirement will be that you must report weekly. If it's better for you to report twice a week or 3 times a week, you can, but the requirement is at least weekly. And again, by June 13th, that Sunday evening at midnight, you better have submitted your vaccination data or you will get a fine. The other thing that I wanted to stress is that because this will be going into a public database, it will potentially be publicly reported. So I know before we were a little bit concerned when the health department talked about, do we want to list all the vaccination percentages out there? Now I'm just alerting you that question may be taken out of our control, and they indeed may be releasing all the data because I understand they're looking at putting it on 5-star. So just know that all your vaccination percentages, the data that you're reporting within your facilities for staff and residents is probably going to be publicly reported. We don't know if the press will pick it up in North Dakota, but as they seem to, I just want you to be aware of that potential in mid-June when everyone must be submitting. The thing that was very positive in looking at a report from HCA this week is they went in to look to see what the percentage was nationwide of those that were reporting right now. And right now, when they went in this past week, there were 3,000 facilities reporting. And of those 3,000 facilities reporting, and just listening to Jenny, the good data in North Dakota of the nationwide, then the staff with the vaccine is 54% compared to our 62%. So we're doing better than the rest of the country, based on 3,000 reporting, and we know that there are a lot more that will report. And then residents, our 92, 93% is fantastic. Of the 3,000 reporting nationwide, that's at 75%. So North Dakota's doing really, really well. Congratulations on that. I know it was our goal within the association to get staff at 80%, and I know you're really working hard on that. But so just a reminder, and we'll remind you continually as an association up until the report of June 13th is start reporting now so you can get the bugs worked out if you have any issues. With that, Tim, I think that's all I have on that topic.
All right. Thanks, Shelley. Alicia is with us and has some information about testing. Go ahead, Alicia.
Just a couple of reminders as far as testing goes. Some people have moved from one location to another as far as their residence. So we have put out a reminder to our doc staff to verify the address of the people testing. We're wondering if the facilities can also just kind of put the word out there that if somebody's moved, that they make sure that we're updating that information in Dynamics when we're linking the specimen. We just want to make sure that positives and negative results are being reported to the right counties. And then also just making sure that the spelling of the first and last name is absolutely correct in Dynamics, as well as matching the labels. We continue to have an occasional specimen that needs to be rejected because that information isn't matching what's in Dynamics versus what's on the label. Just a reminder that we are continuing to offer fit testing events. If you guys would like to do that fit testing event, go ahead and call the doc at 701-328-0707 and they'll make arrangements with you. If you don't have Binax on hand, just a reminder to go ahead and get some Binax on hand. If you guys need to do that immediate testing because of the positive, go ahead and order that through Hans and let us know if you guys have any issues and whatnot. We just want to make sure that you guys have something available on site to meet that immediate need for testing. If you guys do decide to do a Binax event instead of a PCR event that you guys have scheduled with us, please reach out to us and let us know that you're going to be doing that. It just saves a lot of time as far as the couriers delivering the kits to the facilities and then having to pick up the kits, and we didn't use the kits. So if you guys can just make sure that you're calling and arranging that with the schedulers, we would much appreciate that. And then the other thing with the Binax testing, I know some facilities have, if they have a symptomatic person and they've got a negative Binax result, they've questioned it and they've wanted to complete a PCR. If you guys do want to do that PCR, go ahead and reach out to the schedulers and we can try to coordinate with our couriers to have that specimen picked up within a 24-hour period. That way we can save some transportation as far as the facility itself having to bring it to the laboratory. So we have done that for some facilities in the past as well. So go ahead and reach out to your schedulers for any of those tough situations that you guys are in, and we can usually figure something out to help you guys. And that's all I have.
All right. And our final agenda item is to talk about funding, and we're back with Shelley.
We are really quickly going through this, and this again is a repeat item, but I want to make sure that you know that you're not missing out on anything. Originally, and for probably the last 4 months, I've been telling you, we're waiting and expecting the portal will be open for that last go around of federal funding that was passed last year. And I've been telling you that we're anticipating by the end of May, the portal will be open and you can go in and submit your data. Well, it is the end of May and the portal has not been open. So I just want you to know that at this point in time, we're still anticipating those federal funds for long-term care, meaning basic care, nursing facilities, and assisted living potentially. It will be an application process. The portal will be open, but the portal is not open yet. So nothing to really apply for yet. And given that we may not have phone calls for a while, believe me, as an association, we will send you that information as soon as it is out. So don't hesitate to call if you have questions, but we will keep you informed on that. The other two resources and so there are 3 opportunities this last 4th go around, and the portal is not open. The other one is in the last legislation that passed, most recently this year, there was a fund designated for rural providers, and that fund is $8.5 billion. And at this point, we've been waiting for information and instructions on could potentially, since North Dakota is really a rural state and we have many rural providers, would that be an opportunity for you? We still do not know. We're still waiting for information. So just know that when we get that information, we understand more what a rural provider is and what opportunities may be there for you, we will let you know. The third round of potential funding, which we're anticipating later this year, is dollars of money that we're working with in concert with the Department of Human Services to provide some money for basic care, assisted living, and nursing facilities to help support you in the fight with COVID, based on low census, based on greater expenses. And we've been working with them for the last few months. But that is something that we're anticipating will go through the legislature through their special session that's anticipated later this year. So just know that option we're working on, but it will be something later this year. So with that, nothing new to report regarding the money, and we will certainly keep you informed when it becomes available, and we will continue to bug you then to make sure you're applying and aware of it. So back to you, Tim.
All right. Thanks, Shelley. Let's go ahead and see what questions or comments you may have. Remember just to go ahead and unmute your microphone. If you have a question or comment, you can go ahead and say it now. And once you're done speaking, make sure that you remute. So let's see if there are any questions or comments. While you're formulating, I know that a question that came up yesterday during the hospital call was back on the PPE issue about what's the expectation for reimbursement, and it really hasn't changed. At this point, I would still say that we are in a position on the question of is there an expected restoration replacement of the PPE that was consumed from the state medical cash. We won't know the final answer for that until COVID is done. And we still have variants and so forth, but given where we're at right now with our PPE being replenished to pre-COVID levels within the state, and given that the numbers are moving the right direction for the most part, I'll play the role of the optimist. And if this all holds, I don't believe that there's a scenario that's evolving where it will need to be replaced. But I absolutely cannot definitively say that. I still have to hear whatever federal requirements will require of us at the end of this before I can give any definitive answer to that. But I can tell you that we are in a very strong position with the PPE that's in the warehouse. We're either at or higher than where we were with COVID inventories prior to the outbreak of the disease. And so that's looking very favorable. All right, so hopefully I bought a little bit of time, and maybe somebody has a question or comment you'd like to offer.
Question on Bionex Now testing. Is there any way that we can change our auto shipments? We called Abbott and they said the only way to change it is to cancel it completely. We don't want to do that, but we currently have like 49 boxes in our facility, which is 1,900 tests, and we use 30 a month.
So the short answer is I am not aware of anything that can be done at our level. We are frankly now out of that loop completely. At the beginning of this, it was a process where we were doing a redistribution through the warehouse with some, and I'm sorry, you're talking about Bionex testing. That was never true for Bionex testing. So I don't think that there's anything that my shop can do about that. Let me see if anybody else that's part of the panel here wants to comment on that. So Stephanie, I'm sorry, it doesn't sound as if there's really much that we can do. Are they telling you that if you should start to run short that you can't reinstate after you've canceled? I can tell you we have a lot of Bionex testing in the state warehouse as well. So I see that Kirby was trying to weigh in. Kirby, I'm sorry I cut you off if I did, or...
No, I was just going to say, we can try to get an answer. I don't know if Nicole Brunel, I could reach out to her to see if she understands this or not, but it might be worth trying to get an answer here. So,
yeah, so we'll try and follow up, Stephanie, but I know that we're not in the ordering loop per se. And if you could reach back to us so that we can have contact information for you, and we'll try and see if we can give a little bit better answer than what we just provided. But if you should cancel your order, we've got tons of Bionex tests within the state, so I'm confident that we'd be able to meet whatever short-term need you have. All right, any other questions or comments? And Stephanie, I should have followed up. To reach us, it's 328-0707, 328-0707. I think that's going to wrap us up for today. And remember that based on the lengthy conversation we had during this meeting, we'll meet once a month until further notice. Obviously, if something begins to occur that changes this, we'll be in touch with you, and we can always meet more frequently if special circumstances come up. But I would propose that we meet on the fourth Thursday of the month, and so that would be June 24th, and use the same time at 1 p.m. Central Time to hold this meeting. So we'll be back together again June 24th, 1 p.m. Remember, we do have these programs archived, and that's on our website at www.ndhealth.gov/ET. Take care, everyone.